Hey there, welcome back to our channel, where we explore the fascinating world of health and wellness. Today, we're delving into the crucial topic of dementia. But before we dive in, do us a favor and like, share, subscribe, and hit the notification bell to stay updated on all future videos. Alright, let's get started. Picture this. You're out for a stroll and suddenly you can't remember where you parked your car. Or maybe you've been struggling to find the right word in a conversation. Moments like these can make anyone feel a bit uneasy. But how can you tell if it's just normal aging or something more serious? In this video, we'll reveal the 6 warning signs of dementia that you should never ignore. Stick around till the end to find out how you can maintain your brain health and keep dementia at bay. Sign number 1, and possibly the most telling, is memory loss. While it's normal to occasionally forget where you left your keys, consistent memory issues may signal a deeper problem. With dementia, short-term memory often takes a hit, making it hard to recall recent events or conversations. Memory loss in dementia often starts subtly. In the early stages, it might manifest as forgetting appointments or misplacing items more frequently. As dementia progresses, memory loss becomes more severe, and individuals may struggle to recognize familiar faces or recall significant life events. If you or a loved one is struggling with persistent memory loss, it's time to seek professional advice. To help combat memory loss, consider implementing memory aids like calendars, to-do lists, and alarms. Regular mental exercises, like puzzles and memory games, can also help to keep your brain sharp. Moving on to sign number 2, communication difficulties. Ever been tongue-tied trying to express your thoughts? It happens to all of us. But if finding the right words or understanding others becomes an ongoing challenge, it could be a red flag for dementia. Dementia can also impact a person's ability to engage in meaningful conversations. In addition to struggling with vocabulary, individuals with dementia may find it challenging to follow or join in discussions. If this is happening frequently, it's essential to consult a healthcare professional. To support communication, try simplifying conversations, speaking slowly and clearly, and using visual cues when possible. Encourage the person with dementia to express themselves in their own way, and be patient when they have difficulty finding words. Up next, sign number 3, disorientation. We all have moments of confusion, like walking into a room and forgetting why we're there. However, people with dementia may experience a disorienting sense of unfamiliarity in well-known surroundings. Time disorientation is also a common issue, with individuals struggling to differentiate between days, months, or even years. Imagine the unsettling feeling of being lost in your own home. To help someone navigate this challenge, consider establishing daily routines and using large, easy-to-read clocks or calendars. Also, maintain a well-lit and clutter-free environment to minimize confusion and enhance safety. The 4th warning sign to watch out for is changes in judgment. Dementia can mess with your decision-making abilities like a sneaky little gremlin. Suddenly, you might find yourself making uncharacteristically poor choices or struggling with basic problem-solving. Changes in judgment can manifest in various ways, from neglecting personal hygiene to falling for scams or making risky financial decisions. If you notice these changes in yourself or someone close to you, don't brush them off. It's time to pay attention. To support someone experiencing these changes, consider setting up a system of checks and balances to help them manage their finances and daily responsibilities. Also, encourage them to maintain social connections, as isolation can exacerbate poor judgment. Moving on to sign number 5, mood and personality changes. Dementia can create a roller coaster of emotions, with individuals becoming increasingly agitated, fearful, or even exhibiting aggressive behavior. As a caregiver, seeing someone you love going through these changes can be incredibly difficult. But remember, it's the disease, not the person. To help manage these emotional fluctuations, create a calm and soothing environment, provide reassurance, and consider exploring relaxation techniques, such as deep breathing or meditation. In some cases, professional counseling or medication may be necessary. Finally, sign number 6, decline in motor skills. A decline in motor skills can make everyday activities increasingly challenging, eventually impacting an individual's ability to care for themselves. Difficulty with balance, coordination, and basic movements can be frustrating and dangerous. To assist someone experiencing this decline, consider introducing adaptive tools, such as specially designed utensils, button hooks, or non-slip mats. Occupational therapy can also be beneficial in teaching you strategies to maintain independence. Now we know this might seem like a lot to take in, but remember, early detection is crucial in managing dementia and its progression. If you or a loved one is experiencing any of the warning signs we discussed, consult a healthcare professional for a thorough evaluation. While there is currently no cure for dementia, certain medications and non-pharmacological interventions can help manage symptoms and improve the quality of life for those affected. But what about preventing dementia in the first place? We're glad you asked. Here are 6 proactive steps you can take to maintain brain health and potentially reduce the risk of developing dementia. Number 1. Regular physical exercise. Aim for at least 150 minutes of moderate intensity exercise per week to support cardiovascular health and overall brain function. Number 2. A balanced diet. Opt for a diet rich in fruits, vegetables, whole grains, and lean proteins, like the Mediterranean or MIND diets, which have been linked to better cognitive health. Number 3. Mental stimulation. Engage in mentally challenging activities, such as puzzles, learning a new language, or playing a musical instrument, to keep your brain active and flexible. Number 4. Social engagement. Maintain strong social connections to promote emotional well-being and cognitive function. Number 5. Quality sleep. Prioritize 7 to 9 hours of sleep each night, as sleep plays a critical role in memory consolidation and overall brain health. Lastly, at number 6, stress management. Incorporate relaxation techniques such as meditation, yoga, or deep breathing exercises into your routine to help reduce stress levels. So, there you have it, the 6 warning signs of dementia and 6 strategies to maintain brain health. We hope that these detailed insights, practical tips, and coping strategies will empower you and your loved ones to better understand, recognize, and manage dementia. Before we go, we'd like to leave you with a question. What habits or activities have you incorporated into your life to keep your mind sharp and healthy? Share your thoughts and experiences in the comments below to help others on their journey toward better brain health. And don't forget to check out the description box for valuable resources. Thank you for joining us on this deep dive into the world of dementia. Remember, awareness and knowledge are essential in tackling this challenge. Stay informed, stay proactive, and take care of your brain.